Our panelists today are a very distinguished group of people. I've looked at their bios. I was mentioning to Dr. Landreth earlier that I would take an hour to explain everyone's role and what they've been doing with their lives, and that would sort of preclude our show. But Dr. Ed Landreth is a chief medical mental health officer for Veterans Integrated Services Network 12. Michelle Langlois is a suicide prevention program coordinator at the Jesse Brown VA, which I'm very familiar with, an excellent institution. They're doing great work over there. And Dr. Laura Trakhtman, a suicide prevention program lead in the VA Great Lakes Healthcare Network System, Veteran Integrated Services Network 12. Today, we're going to have a discussion about the Jesse Brown VA Suicide Prevention Program and VISN Division 12 Healthcare Integrated Network Services. Welcome, welcome, welcome to all of you. And I'm really honored and pleased to have you on the show. As I mentioned earlier, this is National Suicide Prevention Month. And our service members are still, unfortunately, entangled in this network of despair that brings them to the point of terminating their own lives. But not only do they terminate their own lives, but they terminate the input of a great person for their families and for our nation. They've served and deserve much, much more. So I'm so honored and I'm really pleased that the three of you have dedicated your lives to helping to save our veterans. So I'm going to start off. I'm going to go down the list as they listed as I introduced you, but I'm going to give you each 2 to 3 minutes to talk about what your perspective is on veteran suicide prevention. Why is it so important, and why should we be paying more attention? So, Dr. Landreth, we'll start off with you.
Oh, thank you so much. And first, thank you for the honor to be guests on your show. I know you reach a large network of veterans and veterans' families, and as well as community providers and others out there in the community who all have the same goal in mind, and that is ending veteran death by suicide. This is we're in a crisis. Veteran death by suicide is the number one priority at VA, and it's the number one priority at Jesse Brown VA Medical Center. It's just it's a tragedy. It's catastrophic. It affects not only the veteran and the veteran's family directly, but many other people. So one veteran death by suicide just has a reverberating effect throughout the community. And so again, we've made it our highest priority to put a lot of different systems in place, different opportunities for the veterans to get the help that they need. And again, it's something that we hope that we can bring an end to sometime soon. Thank you.
And Michelle, what is your perspective on this issue?
Um, well, my perspective is that suicide is preventable. That's something that people don't always think. They feel like sometimes there's nothing I can do about it. And actually, it's quite preventable. And I think that because of stigma, a lot of times people aren't talking about it. They don't understand it. They don't know what to look for. And so it's really important, at least on the clinical perspective, role that I have and my team role has in order to and get our veterans what they need to kind of help when their crisis escalates so we can decrease their risk and promote community or other kinds of protective factors to keep them safe, educate people in the community, educate our providers. So thankful that you have us on here to educate your viewers because there's a lot we can do in order to reduce veteran suicide if we continue that conversation and continue to target not only our veteran population, but educate people in the community and their family members. And so for me, this is something that we absolutely can tackle. letting people know that this is preventable. There's lots of resources the VA has, and there's lots of resources the community has, and we're partnering with them in order to work together to reduce veteran suicide.
Licensed clinical social worker. It's near and dear to my heart. My mother was a social worker from the time she was in college until she was 91. She passed away from a massive stroke. But 2 weeks before she passed away, she was knocking on people's doors and make sure they were taking their medications. So she was a lifelong social worker. And so the work that you do is invaluable to our service members and to our communities. So, but Dr. Troutman, how do you feel about this?
Both of my colleagues talked about suicide is preventable, and it takes the VA and the community coming together to really partner in the public health approach, where we recognize that majority of veterans are not seen in our healthcare systems, and we have established relationships with our community partners that I hope to highlight a little bit later, where we really try to engage veterans and their families and their communities in preventing veteran death by suicide. And I'd like to say that, we grew up in the VA. I did my clinical practice in the VA, and then I became a VA psychologist. It's been many years. And this is truly the first time in the past 15, 16 years where VA has stepped out of their role as just a healthcare provider and really embraced the importance of these relationships in partnerships with the community and other governmental agencies. This is a really exciting time for us.
Oh, fantastic. Yeah, so Dr. Landreth, what do you think are the major problems that our veterans are confronting right now? Is it, access to care, or is it that this is not being recognized for what it should be? The resource allocations for it. What do you think are the greatest challenges you face in taking care of our veterans?
Thank you. That is a very good question, and I'm very happy that you asked that question. Veterans, we know that veterans are at higher risk for death by suicide than the general population. The National Veteran Suicide Prevention Annual Report came out for 2023, and it shows that veterans are around 71.8% higher than non-veteran adults to die by suicide. And this again is just a very serious problem. That's an understatement. One veteran death by suicide is too many. So you mentioned access, and we talk about resources, and so the VA has put so much into trying to end this problem. And we've taken, like my colleague just mentioned, we've taken now a community health approach, because we realized that we cannot manage this alone. We need to partner with the community. We need everyone's help. It's all of our problem when it comes to ending this veteran death by suicide. There are many things that can lead to veterans wanting to take their own lives, and stress, such as divorce or job loss, health problems, loneliness, substance abuse, housing problems. It's very complex. It's a complex problem, and that's what makes it very difficult. And so again, we're committed to this public health approach, and access. I was lucky enough to be. I'm a member of a subcommittee on access, and this is at the national level. And I was just in Washington, meeting with some of the highest members of the VA team, and it's about access, being able to get those veterans in for the care that they need when they need it, and so. I think we've improved quite a bit over the years, but we still have a little. We have a little work to do, and so it's again a priority of ours to make sure that we have the resources, the programming, and we have the ability to allow open access to veterans to get the care they need.
Well, there are
There
some
are some
things
things.
as talking about Dr. Trakhtman, I think I pronounced your name correctly. um, I was wondering, there are so many different situations that arise, and I was wondering if you could tell me about one of the success stories, because I know there are many of how you guided a veteran, on the right road, and to bring them out of this state of depression, because people don't realize it's not just an individual suicide, but it's also the loss for those people who were there, um, soldiers in combat arms, or people who were part of their Marine group or their Navy group or their Air Force group that were deeply affected by their death as well, and their families, their spouse, their children. This is really a devastating impact. It's not just an individual that's out there by themselves, and even their coworkers, when they're seeking employment, those kinds of things. So, do you have any success stories that we can have? I wanted to show that you can actually pull yourself out of this.
Yeah, absolutely. Gosh, where do we start? I've talked about having this public health approach where we work with, other government agencies. We work with our governor and through the governor's challenge to really engage individuals in these important conversations. But on a personal level, we both, all three of us see veterans in our daily lives in our clinics. And we were lucky enough to be able to bring in a cutting edge evidence-based treatment program to our network that is available to veterans in all 8 healthcare systems that we cover, where we do a group in this kind of format, in the video format, where veterans come together and learn skills to manage their suicidal thinking. And at the end, we've been doing this actually today. We kind of talked about it. We've been providing this evidence-based treatment for the past couple of years, and get to check in with veterans. How they're doing at the end of the treatment. I am so lucky and blessed to say that we have not lost the veterans since we've started this group, and in fact, we get extremely positive results from veterans saying. One in particular veteran talked about how he woke up feeling in crisis and was able to use the skills that we taught him to manage his suicidal crisis, and joined the group and really engaged his peers in important conversations about kind of health and asking for help and looking at it as a strength. And I think kind of the bigger combination for the VA, we rolled out our campaign to save veteran lives for suicide prevention. And we have veterans that talk about their struggles with suicidality and engaging their partners in these conversations and really getting over the stigma of asking for help. And I think it is just such an important conversation, whether or not it occurs in the therapy session, behind the closed doors, or if it's occurring as a national campaign for the VA, where we really engage the right stakeholders in these conversations and share success stories. I didn't particularly prepare a success story for today, but this was the first one that came to mind, as we were one of the first in the nation to pilot this program, and are just so grateful to have such wonderful results.
Fantastic. I love that. That's such a human. That's such a huge success story. Because I really care about veterans. Of course, I was in combat and saw a lot of people, go through quite a bit of emotional and physical trauma. But going to Michelle, Michelle, I know this is a campaign season, but I see a campaign behind you about dialing 988. Maybe you can tell us a little bit about that. Then I'm going to ask you a question.
The 988. So as you can probably see behind me, I'm in the way, but it's Veteran Crisis Line. About 2 years ago, it switched from an 800 number, the whole country did, to 988. And this was so that it would be easier for anybody in the country with a mental health crisis to call, just like we would do for 911 for a medical concern. For veterans, they would press 1 to get to the veteran side. Um, the the national line is managed by SAMHSA, and our line, the Veterans Crisis Line, is managed by responders from the VA. They're very well trained. They manage the crisis at hand at the time people call in. And people for the Veterans Crisis Line can call in for any kind of crisis. There's a misconception sometimes from our veterans that they have to be suicidal to call, but we really want people to call when the crisis starts so that we can address that crisis, get people the resources and the support and the care they need so that it doesn't escalate to suicide. So that surprises a lot of veterans. So it is a crisis line for all kinds of crises. The really interesting thing that we do that's different than SAMHSA is that if a veteran calls the crisis line, they offer to have a follow-up call from the suicide prevention team, which would be my team. And then we would call the veteran back, provide additional resources and support. And even if the veteran isn't eligible for VA healthcare, it doesn't matter. My team still has to make sure that we get them the resources and referrals to whatever it is they need to address their crisis. So it's a really, really good wraparound system that people don't really know all the details about kind of how the Veterans Crisis Line works. So the one other concern people have sometimes, if I call the Veterans Crisis Line, they're going to send police or EMS to my home. And if you look at the data, the VA, the Veterans Crisis Line very rarely does that. The only times they would do that is if the veteran asks to have EMS sent to their home, which does happen actually quite a bit, or they just can't maintain safety. They're going to be a danger to self, and we have to make sure that they're safe and they're okay. And that's still very rare. So majority of the folks who do call, EMS never gets involved. So anybody listening, I hope that kind of maybe relieve some of those fears. It's a really wonderful resource. And if you're worried about a veteran, you can call with a veteran if it's your buddy. We have a lot of people will call on behalf of a veteran they're concerned of as well, even if you're not in crisis. So it's a resource not just for veterans, but for families and friends of veterans and also active duty military.
Oh, fantastic. Yeah, because the question I had for you as well, my mother, as mentioned before, she's a social worker. So if I said, well, the person has a mental health problem, she'll say, so they don't have a body? And then I'd say, well, they have a physical problem. Well, they don't have a mind, So she always brought those two together, saying that it's a whole person. So even though we're talking about, mental health issues, sometimes people have disabilities as well, or have been, scarred by war. So from a sociological standpoint, what are some of the special challenges that you see with people who do have disabilities or are facing those kinds of medical issues that are impacting their mental health? And then I'll move to Laura and Edward on that question as well.
Um, we do know that some of the risk factors that can lead to veteran suicide can be physical limitations due to kind of chronic or severe health issues. So as people start having more deterioration in their health as they age, we can see that sometimes the suicide risk can increase. Pain is a big issue. A lot of veterans really struggle with pain. And so that can definitely be a pretty big risk factor. And so we want to make sure that we're addressing these concerns for our veterans, their health needs. If there's a disability, what can we do in order to kind of get them to have better functioning? Is it working with prosthetics, being more mobile? We have veterans who get, their electric wheelchairs, and that's like a life changer for some of these folks. Getting, again, their pain managed. Also doing education with our medical staff to understand that a lot of folks that they're working with, these can lead to thoughts of suicide, so they can look at the whole person and understand more holistically that treating their health is also treating their medical needs. And I just did actually a training today at University of Illinois, training their medical residents actually earlier today. So, kind of making sure that not just mental health providers are aware, like you said, it's the whole body. We have to make sure that everybody treating the whole body is aware of these risk factors and the needs to treat the whole person.
Okay, Laura, what's your perspective on this?
Well, just I suppose I'll piggyback on what Michelle was saying. We, at the network, we kind of take a bigger approach, and our jobs is to examine every death by suicide that occurred in our medical centers, and based on that, we adjust our treatment direction for our network. And so that occurs every year, and it's an important process by which we really do boots on the ground improvement in real time with kind of looking at what's occurring in our medical centers and then changing our clinical direction. Every veteran now gets screened for suicide when they come into our medical centers at the minimum once a year, but usually if there's a cause, we always use evidence-based tools in screening them, regardless of where they're being seen. So, thinking of the mind-body approach, right? There's so many veterans that are never seen by mental health providers. And VA had recognized the importance of engaging these veterans wherever they're at, audiology, optometry, wherever they're seen within our medical centers, we ensure that we screen and ask the questions, them, their loved ones, whoever they're with. So it's an important part of what we do in the VA, that level of engagement. And of course, if someone is in crisis, then we have ways to help them manage the crisis with our mental health providers or not. For example, this September during Suicide Prevention Month, we've partnered with our other networks, so the entire Midwest. And our goal this year is to retrain and re-engage all of our providers, within our Midwestern states, so Illinois, Wisconsin, and we just go down the list, where we're bringing them for kind of training, weekly training on cultural awareness of suicide prevention. And we kind of this constant retraining and re-engagement of providers outside of mental health so that they know what to look for, they know how to ask the questions, they feel comfortable having these conversations.
We have about 4 minutes to go, and it's a time that always goes fast. They're telling me 2 minutes, but we're going to try to get a little bit more. So, Ed, you can go ahead and give us a brief kind of hit on this particular issue.
Yeah, my colleagues answered the question very well. Through our analysis that we do every year, we know that veterans who are older and veterans who have chronic health problems are at high risk for suicidal thoughts and attempts. So we've done a lot of different things, as Dr. Trakhtman mentioned, but also we're looking at embedding providers in the specialty clinics outside of mental health to be able to assist those clinics and those clinicians and those veterans, for example, who come into the pain clinic with chronic pain, or veterans who are even in primary care. We have what is called primary care mental health integration, where we have clinicians there ready to assist those primary care docs if they become concerned, or if the suicide screening is positive, then we can act immediately or as quickly as possible to treat those veterans.
You, all three of you, this has been enlightening. I'm not sure if you know, we broadcast into 19 countries. We actually have global, reach throughout the country here. Many of the VA facilities and a lot of things in the Department of Defense, the VA system, and Department of Labor also hear our program. But we're going to have you back, all three of you. I actually have a few more questions I should have gotten to, but believe me, there is a lot more that we can talk about. So we will be reaching out to the three of you to come back on. But thank you again, Michelle, Laura, and Ed. You all three have provided our veterans with an invaluable resource and their families, our community, and our nation. So again, I applaud you all for what you do.